Assalamualaikum and good day everyone. Welcome back to PHC 461 Principles of Pharmacology. At last, here is the last lecture for this course, and this week we are going to discuss on the adverse effects as well as toxicity. Here is the learning objective for this week lecture. So at the end of this week lecture, you should be able to define and discuss the adverse drug reactions and its classifications, which is the two major ones. Discuss the factors that affect the susceptibility to adverse drug reactions, or the short name as ADR. Discuss the pharmacovigilance as well as discuss the role of health professionals, particularly on pharmacists, in managing the adverse drug reactions. So I divided this week lecture into 3 videos. I believe that everyone still could remember this graph. Yes, this is the steady state concentration graph. So drugs that require repetitive use, such as anti-diabetic drug as well as antihypertensive medications, will achieve this kind of graph if the patient comply to the treatment regime and take the medication as instructed every day. Most of the drug has wide therapeutic range. Yes, this is the range that we want to make sure every patient able to achieve, to make sure that their treatment exceeds their therapeutic effects. If the plasma drug concentration below the therapeutic range, it called as subtherapeutic range, which the patient didn't receive maximum benefit from the treatment that they have received. Some of the drug has narrow therapeutic range, such as warfarin, antibiotics such as aminoglycoside and cyclosporine, and drugs that used in the treatment of epilepsy such as phenytoin and carbamazepine should be monitored their plasma drug concentration periodically to make sure the safety of the patient as well as patient receive the maximum therapeutic effect from the treatment time to time. However, there are few incidents of adverse effect that can be happen even though the drug plasma concentration within this therapeutic range. So I can say that within this therapeutic range, instead of the treatment can exert the therapeutic effect, the drug also may cause other unwanted effects which known as adverse effects. If the drug plasma concentration keep increasing and exceed their minimum toxicity concentration, or known as MTC, it may cause toxic effect to the patient. The World Health Organization, or known as WHO, define adverse drug reaction as a response to a drug that is nauseous and unintended and occur at doses normally used in men for the prophylaxis, diagnosis or therapy of disease, or for modification of physiological function. Recently, the European Union definition of an ADR has been expanded to take into account of off-label use, overdose, misuse, abuse, and medications error. So, the term adverse drug reactions and adverse drug effect can be used interchangeably. Adverse reactions apply to the patient point of view of time, whereas adverse effects applies to the drugs. So there are two methods to be able to classify adverse drug reactions. There are RAWLINS-THOMSON classification as well as dot system. For RAWLINS-THOMSON of classifications, they are divided into 6 types of classification as shown in this here. A for augmented, B for bizarre, C for chronic, D for delay, E for end of use reaction, and F for failure of therapy reactions. So let's get deeper into the details of each type. For type A, or augmented type of reactions, these are based on the pharmacological properties of the drugs, and so they can be predicted and are very common. This reaction is dose-dependent reactions that occur at either normal dose or overdose, and hence can be prevented by reducing the dose or withdrawing the drugs. The effect is usually mild, but also may cause serious incident in some cases. So they are related to high morbidity and low mortality rates. Example is hypoglycemia incidence due to insulin administration. As you know, For those who are type 1 diabetic or uncontrolled type 2 diabetic patients who are taking insulin as part of the treatment regime, supposedly to reduce their blood glucose level to the normal targeted level, which is to 4 to 6 millimole per liter. But unfortunately, patient may experience sweating, palpitation, weakness if the blood sugar level is reduced too much, is less than 3.0 millimole per liter. Thus, this reaction can be considered as exaggeration of the drug's therapeutic effects, which means these reactions are occurring due to the reaction of drug itself in excessive manners. Another example is NSAID, which is the painkiller. The most common adverse effects that can be caused by this painkiller is this drug can induce the gastric ulcer. Thus, we as a pharmacist should advise the patients to take the NSAID with meal or make sure do not take it on the empty stomach to prevent any gastric ulcer or any stomach or GI disorders. So, moving on type B or bizarre reactions, which also termed as idiosyncratic reactions. They are novel responses that are not expected from the non-pharmacological response of the drugs. Therefore, you can say that they are unpredictable and less common. In contrast to type A, they are not dose-dependent. Despite being less most common than type A, they are often with serious case associated with higher morbidity and higher mortality rate. They are often caused by immunological and pharmacogenetic mechanism. Immunological reactions such as anaphylaxis in response to penicillins are very common in type B reactions. Other examples may include aplastic anemia caused by chloramphenicol. This is unpredictable adverse effect in serious, rare, and can cause fatal. This is severe idiosyncratic depression of the bone marrow occur with cause pancytopenia. Pancytopenia is a condition where a person has low counts for all three types of blood cells, including the white blood cells, red blood cells, as well as platelet. Now, that's all about type B reactions, and moving forward to type C reactions or continuous drug use reactions. This is due to the chronic use of a drug or due to dose accumulation. They persist for a relatively longer period of time, and this is the actual reasons they are often termed as continuing reactions. This type of reaction is fairly uncommon and usually dose dependent and time dependent as well. Type C reaction often include osteonecrosis of jaw due to consumption of biphosphonate or Cushing syndrome that may be associated with the corticosteroid medications. Now, come to type D reaction or delay reactions. This type of reaction usually appears sometimes after the use of medicines. This refers to the drug effect that occurs due to the prolonged use of a drug which does not tend to accumulate. This reaction is usually uncommon and dose dependent. The timing of type D reactions make them difficult to detect. Sometimes they can considerably lag time between the termination of the treatment and the development of the condition associated with the therapy. The most common one is the carbidopa that causes the tardive dyskinesia. Now you guys must aware that some reactions are linked to the withdrawal of medicines, and these kind of effects are known as type E or end-use reactions. These reactions are uncommon and occur soon after the withdrawal of particular drugs such as beta blockers that can induce rebound tachycardia and hypertension. Another example are patients who may experience relapse seizure after stopping the phenytoin therapy. Withdrawal symptoms such as nausea, vomiting, stomach cramp, diarrhea, etc. may occur due to or associated with the discontinuation of opiates such as morphine, codeine, or heroin. That's why to those who are abused with this kind of opiates, which one to withdraw themselves from taking this drug may experience these withdrawal symptoms. So they required methadone therapy to relieve these opiate withdrawal symptoms. So heading towards the last type of reactions before we having a short break, there is type of reactions that are characterized by unexpected failure of the therapy. So this reaction is common and dose related and often caused by drug-drug interactions. The most common example is treatment failure of anti-diabetic due to the dialysis, aside from the resistant issue of antibacterial, as well as failure of oral contraceptive or known as OC therapy due to the enzyme inducers.